Instagram and here on YouTube Live. Today I am talking about instrument chiropractic, and instrument chiropractic involves using techniques like the activator, which is this instrument right here, to adjust the spine and the joints. We have other instruments as well, like the integrator, this instrument right here, and I'll talk more about that as we go along with the webinar today. I've been using instruments for over 20 years in chiropractic, and instruments are very effective in treating certain conditions, and I'm going to get into that in today's webinar. Now, if you have any questions, please type them here in the chat. You can comment on Instagram, on YouTube. You can type in the chat, and I'd be happy to answer those for you. So let's talk about instrument chiropractic, and I am Dr. Cary Yurkiw. I'm a chiropractor here at Tut Street Family Chiropractic, and we want to talk about the gentle and precise technique that instruments offer for spinal alignment and joint health. I've been a chiropractor for 30 years now. I work on Tut Street at Tut Street Family Chiropractic. I started the practice in May 2023. And before that, I was practicing in Winnipeg for 15 years. I was in Penticton for 10 years, and then our family moved up to Kelowna. I joined a group practice for 4 years, and then opened my own clinic last year. I personally had good experience with chiropractic. When I was a teenager, I had a lot of knee pain. My father took me to a chiropractor in our area, and he examined my knees, and he did treatments to my knees, which really made a big difference. My knees were painful for a couple of years, and with the chiropractic care, it allowed me to play hockey and do exercise that I couldn't before because of my knee pain. So that had a profound difference, made a profound difference in my life. And today I'm excited to share specific information about chiropractic relating to instruments. And I think you're going to find this interesting because it's a different way of practicing chiropractic, and it's a very effective way of offering different types of treatments in the clinic. Also, I'm going to share some of the principles about our practice, why it's different from other types of healthcare practices, and why we're different from other chiropractic clinics as well. So first, the introduction to instrument chiropractic. What is instrument chiropractic? Well, instrument chiropractic uses something called an activator or an integrator to do adjustments. There's other instruments in chiropractic as well, but I use these two primarily. I started using the activator, which is this one right here, about 20 years ago. And this technique using the activator is very powerful technique because what it does is it uses the alignment to the body. We do leg length checks when the patient's lying on the table. We assess them for misalignments. We test certain areas, and then we adjust those areas and check and see how the body realigns. It's a very powerful technique, and I like to use the activator as well on other areas like the rotator cuff or the elbow and the wrist. Basically, any joint in the body that's out of alignment, the activator can work on and can be very effective. Now, there's different ways to apply the activator in chiropractic, so different practitioners may use it in different ways, but I find using it on some to most of my patients is very beneficial in addition to adjusting the patient hands-on or using traditional spinal manipulative therapy for their spine and joints. Now, the other technique that I use is this one right here called the integrator. The integrator is a little bit different in that the instrument gets preloaded with a certain amount of force, so we can preload it and then do the adjustment with it. And this instrument can also be turned or twisted to provide some torque. And this technique is called torque release technique. This is more of a tonal technique, meaning if there's tension in certain areas in the spine, this technique will help to relieve the tension to regulate the nerve flow and improve the way the body functions. So integrator is a newer technique compared to activator, but I've been using integrator for over 15 years now, and I find it's very helpful for people with certain types of conditions. We're going to talk more about that today. Now, the science behind the activator and the integrator. The activator has a lot of research behind it. Let me see if I can just pull this over right here onto the screen. And Activator Methods, Dr. Arlen Fear designed this technique, and they've done a lot of research on it. And if you go to the research tab right here on their website, you're going to see all the research that's been done on the activator. Randomized control trials, which are high-level trials on different types of conditions and different age groups, different areas of the spine. Very effective research, and that's been going on for a long time. So it's a well-proven technique that we use in chiropractic, and you can go to activator.com to view that research. Now, it's different than other methods in chiropractic because I find the instrument method to be very specific for a certain area. For example, sometimes there's ribs that are out of place, and if I find I can contact that rib head with the instrument and adjust it, that's a very specific way to adjust the joints. So I like to use it in certain areas, like the ribs, like the neck area, which can provide very gentle and specific force to adjust that segment into a better alignment. It avoids traditional twisting and popping because we're doing micro movements of the joint. So when we do the adjustment, there's a reaction. The tissues around the joint react to the adjustment through reflexes, and there's no popping or cracking. So unlike traditional chiropractic, when we do an adjustment, there's something called cavitation, or a release of pressure in the joint, which causes a popping noise. Instrument adjustment often does not involve popping or cracking noises. And a lot of people like that because they're looking for something as an alternative to the cracking techniques, the manipulation or adjustments that we do. So they do like the instrument techniques, and some people just prefer to get instrument adjustments and not the traditional hands-on. Now, the benefits of it is it reduces the pain in the body, so it reduces joint pain, improves your mobility, enhances the nervous system function. And again, the two techniques work differently, the activator and the integrator, but similarly, they do improve the way you feel, improve the flexibility, and improve the nervous system function in the area. I'm going to try and pull up here the integrator technique for you too, just so you can see a little bit more about that. And let's see. Yeah, here we go. So torque release, this is Torque Release Australia. It looks like their website talks about the integrator technique and how it works, and the torque release technique and why it works. Very interesting technique that was developed in the United States, and there's a lot of research that's been done on torque release as well and how effective that is. So you can go to torquerelease.com. Let's see if we can just type in torquerelease.com, get the US site up here. Here it is. And this will tell you more about the tonal specific technique and how that works. So right there, and you can go to the research that's been done on it. You can see how it works right here. So lots of research on the torque release technique as well. Now, what to expect from instrument adjustments? And what does it look like when we use that in the clinic? Well, one of the things that we do is we usually start with the patient face down. They're on the table, we check their leg lengths. I ask the patient to turn their head to the right and left. I press on certain areas in the spine to see if those areas are reactive and receptive to the adjustments. So not only are we looking at the structural alignment to the body, but the tone of the body as well. Where is it carrying tension, and what do we need to do to help to realign the area and to improve the tone of the area, the function of the tissues and the nervous system. It's a non-invasive treatment. You can see right here, this chiropractor is doing an adjustment to the patient, very light tapping on the joint. So this instrument right here, the activator, can be calibrated, and just a light tap on the spinal segment or the joint can help to realign that joint. And it's very comfortable. People find it very easy to get the adjustments. They can basically just relax, and that can help them to be more receptive to the adjustments. I tend to adjust the spine face down for most of the instrument adjustments, including the neck, so patients don't have to turn a lot. They're face down when I do the adjustments. And then if I have to adjust any extremities, like the elbow or the shoulder, the wrists, the ankles, the knees, then it's a matter of turning the patient over and doing those adjustments. So very gentle technique, feels really good. I personally get the activator technique done by my chiropractor. Every 2 weeks I go and get a tune-up just to maintain my health, and activator is one of the techniques that I get done. I also get the integrator technique, so both techniques actually get done to my spine. Now, as far as patient testimonials, I shared some of the research with you, but for our clinic, a lot of the testimonials that you can find are on RateMD. And if you go over to RateMD, you can type in my name, Dr. Cary Yurkiw. You can see all the reviews, and a lot of them are recent in the last few months, and you can see what patients are saying about the types of techniques we use in the clinic. So you can go over to RateMD's and see the research, as well as Google. Google's a good place to see the reviews that we have as well. And you can type in Dr. Cary Yurkiw on Google. You can see right here the reviews that I have, and then just read what people have said about chiropractic in the clinic and how we've helped them. So a number of different techniques and a number of different conditions that we've seen here in the clinic. And if you have neck pain or back pain or whiplash or joint pain, you're going to be able to find a review or testimonial from one of the patients on that. Now, do you have any questions on instrument chiropractic? If you do, please type them right here in the comments or in the chat on YouTube. I'd be happy to answer those. Even if you're watching a replay of this at a later time, you can type your question into the comments or the chat. I'd be happy to come back to YouTube or Instagram just to check on it and answer your questions. Of course, if you don't have any questions, you can always come to the clinic and book an appointment, and we can always discuss that here in the clinic as well. But if you do have a question right now, I can answer those for you here on social media. Now, how do you get started with chiropractic? Well, you can schedule your first session in the clinic by going to our website. I'm just going to bring that over right here. This is tutstreetfamilychiropractic.com, and you can click on the Book Now button, which will take you over to our booking site. It's really easy to do. There's 2 or 3 quick steps: your name, email address, a mobile number, and then you can pick a day and time that suits you and book your appointment. It's that easy. We'll send you the paperwork via text usually or email, and then you can enter that paperwork so we're ready for you when you come to the clinic, and then we can do the thorough history, the examination, tell you what we found out, and then start the treatment. So very simple process. If you want to know more about the clinic, you can click on About, or the services we offer, including shockwave, laser therapy, orthotics, some of the other services we offer here in the clinic. So that's a great place to go. Now, if you do want to come into the clinic, I'm offering you a discount today. You can get 10% off if you book before the end of the month, April 30th, and you can use this coupon code WB-INST for this webinar on instrument chiropractic. When you go to book your appointment, which I just showed you, in the appointment notes, type in this coupon code and 10% off, and we'll make sure we apply that to the first visit. So there's a good offer for you. And then last, the next webinar we're doing, now we do these lunch and learns at 12 noon, like today, but we also do webinars in the evening called The Dinner with the Doctor, and this is going to be May 2nd at 7 p.m. So I'll be talking about how to choose the right chiropractor for your needs. So sometimes people have never been to a chiropractor, sometimes people are skeptical, they're wondering, can chiropractic help? Is it going to hurt? I'm going to cover all that at this webinar on May 2nd. Now, if you'd like to book an appointment, I'll put a link in the show notes, or you can go to the link in the bio on Instagram. The advantage of coming to our clinic is we're open 7 days a week. Often we can see patients the same in the next day. So we are accepting new patients, no doctor referrals needed, and we do bill directly to insurance, including ICBC, if you've been in a car accident here in British Columbia. So feel free to book an appointment online. If you're not in our area, but you'd like to see a chiropractor in your area, feel free to reach out. Again, just send a direct message or a comment, and I'd be happy to respond and refer you to a chiropractor in your area, if I know one, that does a good treatment, good technique, like the one we talked about today, the instrument techniques, activator, integrator technique, similar to this. I'll find you a chiropractor in your area that I can refer you to. Often I know chiropractors in Canada and the US, but if you're in a rural area or you're outside of this region, it might be a little bit harder to find a chiropractor in your area, but I've also looked up chiropractors in Tokyo and chiropractors in Europe, and done my best to refer someone to a chiropractor that can help them in their area. So thanks again for joining me today. I hope you learned something